Hi there, it's Cherylea from Anatomy for the People. In this video, I'm going to be talking about vasectomies. And I'll be talking about what actually makes up semen and how the contents of semen changes after this procedure. Okay, so when you think of semen, you might think of sperm cells. And that's correct, but that's not the whole story. Sperm cells definitely are the major player of semen, but they only contribute a very small amount to the overall sample of semen. There are actually 4 glands within the male reproductive tract that contribute fluid to make semen. So I've just drawn a schematic diagram of the male reproductive tract, including those important glands. So in the middle here, we can see I've drawn cross-section of a penis. Up the top here, we have the bladder, and you can see that there is this tube that's connecting the bladder to the end of the penis, to the outside world. So that is our urethra, and you may be familiar with that as transmitting urine out of the body. So it is the urethra that also transmits semen. So the urethra transmits both semen and urine, but never at the same time. Okay, so as I said before, semen is made up of the secretions or the fluids of 4 separate glands. So let's start with the sperm cells. So the sperm cells only contribute 5% to a semen sample. So where do sperm cells come from? They are produced in paired organs called the testes. The testes are found within the scrotum, which is external to the pelvic cavity. Within the testes, we have tubes and channels and lobules where millions and millions of sperm cells are created daily. Once the sperm cells are mature, however, non-motile, they are moved into this structure that is on the backside of each testis. This is the epididymis. The epididymis is the storehouse of sperm. There is a tube that runs through the epididymis, and it is so densely packed in this small little area. If you actually pulled it out and measured it, it would measure 6 meters long. 6 meters in this tiny little thing. Amazing. So when there is an ejaculation, the walls of the epididymis and of that tube itself is going to contract and squeeze a small amount of fluid that is carrying all of those sperm cells up through this duct. And this duct is called the vas deferens, also known as ductus deferens. So the sperm cells are forced up, go towards the bladder, into the pelvis, and they actually enter in to the urethra. And the part of the urethra that they actually enter into is situated within the prostate gland. And so this part of the urethra is called the prostatic urethra. And the prostatic urethra, compared to other parts of the urethra, has little tiny holes in it. And this is what allows fluids that actually come from the prostate gland to enter in. So we also have the ducts from the vas deferens coming in and some other glands. So also going into the prostatic urethra, we have the ducts of the seminal gland or the seminal vesicle. So these are paired. So we have one on the left and one on the right. And so these are found on the posterior aspect of the bladder near the base. They're actually going to contribute a large amount to semen. So the fluid that they produce is called seminal fluid. And seminal fluid makes up about 70% of our semen sample. So seminal fluid is really important. It contains fructose, citric acid, enzymes, hormones, and it has a really important function to provide energy and protection for the sperm as it enters into the female reproductive tract. It also triggers motility in non-motile sperm, and the compounds within this fluid also lowers the female immune response, because technically sperm entering into a female reproductive tract would be considered foreign. So the female's immune system would target that. So decreasing the female's immune response is really beneficial to allow enough time for the sperm cells to actually make it towards an egg. Okay, So the next fluid that is going to contribute to semen is fluid from the prostate gland. And the prostate gland is here, so I've highlighted it in blue. And so the prostate is going to be encircling that part of the urethra. So in an ejaculation, the prostate gland is going to squeeze, pushing the prostatic fluid into the urethra. And prostatic fluid contributes around 25%. So the prostatic fluid is going to include citrate, enzymes, and hormone-like substances. And its function is to activate sperm and activate sperm motility. So lastly, we have the bulbourethral glands. The bulbourethral glands, they're not going to be draining their fluid into the prostatic urethra. They're going to be draining their fluid directly into the penile or the spongy urethra. So the bulbourethral glands are actually situated within a muscle layer, and that's actually the pelvic diaphragm. So the bulbourethral gland secretes a mucousy fluid that's rich in glycoproteins and functions to neutralize acidic urine that has been left behind in the urethra. And it's also really important for lubrication. So bulbourethral glands produce bulbourethral fluid. And it contributes a very, very small amount, probably less than 1%. So it has no role in sperm activation or anything like that. It is just clearing the path for the semen to actually make its way through. So it gets caught up with the semen because it just gets collected with all the other fluids. Okay, so a sperm sample generally is between 2 to 5 mils. So when you're looking at the percentages of all the contributions, sperm cells really, don't contribute that much, 5%, even less than 5% sometimes. And this is important for when we talk about vasectomies. So what a vasectomy is a surgical procedure where the vas deferens is cut. And the reason for this is because we want to take sperm cells out of the equation. Because sperm cells are, as I mentioned before, the major players in fertilization. So if there are no sperm cells, but with all the other fluids, then there's not going to be fertilization. So a vasectomy is a long-term solution for male contraception. So if we cut the vas deferens on either side, we will still have the rest of these fluids being created to produce a semen sample. However, it will lack sperm cells. So there are some common misconceptions about vasectomies. And one of the main misconceptions is that there's going to be a significant change in the look of semen and also a significant change in the volume of semen that is produced after a vasectomy. But now we know that sperm cells only contribute to 5% or even less than 5% in a sample. So after a vasectomy, 1, there's going to be no change in the look of semen, and 2, there's not going to be a significant change in the amount of semen that is produced because the bulk of the fluid is really coming from the seminal glands. You would have more effect on the volume of your semen depending on your hydration levels. So if you are dehydrated, that's going to mean there's less semen fluid volume. And if you're hydrated or even overhydrated, then that's going to mean higher amounts or higher volume. So another misconception about vasectomies is that men who have vasectomies won't be able to maintain an erection, or they will lose their sex drive or have a lower amount of libido. So since we are cutting the vas deferens, there is actually no damage done to the testes. And we know that the testes are going to produce hormones such as testosterone, which plays a major role in sex drive and libido. So if the testes are intact, there is no physiological effects on libido or sex drive. So the other misconception about a man not being able to maintain an erection after a vasectomy, this is also untrue. For an erection to occur, there needs to be increased blood flow to the penis and a decrease in venous drainage of the penis. So by cutting the vas deferens on either side, it's actually completely separated anatomically from the penis. So there is no anatomical or physiological reason that a vasectomy would affect the maintenance of an erection in a man. Okay, and that's it. Thank you so much for watching. I hope you learned something today. See you later.